Hi, everyone. My name is Dr. Rupa Dutt, and I'm the Executive Director of Women in Global Health. Just going to give everyone just a few more minutes to log in. And we are currently live for the event In Their Words, Stories from the Outstanding Women Nurse and Midwife Leaders of 2020. We'll be starting shortly, and meanwhile, as you are coming into this event, we really encourage all of you to engage with us. There is a Q&A function available. Please submit your questions. We will try to see if there is any chance for that in the program. We also will be engaging on social media. Please use the hashtag YONM100, and you can tag all of the organizations here, and in the chat function we'll just make sure you have our handles, but you can tag at women in GH, and we'll make sure to be looking out for your mentions, and encourage you to please use this as an opportunity to share your thoughts on all the outstanding women nurses and midwife leaders that are working during these times. We're just going to give it another minute before we get started. Great. So welcome everyone again, and we're going to get started with our program. We have a very exciting lineup. My name is Dr. Rupa Dutt, and I am the Executive Director of Women in Global Health. We're a global movement striving to achieve gender equality in global health leadership by challenging power and privilege for greater gender equity in health, and really excited to welcome our esteemed panelists today. And this particular event is brought together as a result of 5 partners coming together to put together the first 100 plus list of recognizing women nurses and midwife leaders from all around the world. They symbolize the hard work that many millions of midwives and nurses are doing to provide care, especially during pandemic times. And this is just a representation of, again, millions of leaders at the front line. We know that 2020 will go down in history as a year of a global pandemic. It has infected around 100 million people worldwide and caused the deaths of nearly 2 million. History, however, is generally not written by women, and there is a danger that history will not record the extraordinary contributions made by women who comprise 70% of the health workers and have been on the pandemic front lines delivering care and saving lives. They put their own health and safety at risk, and when the story of the pandemic is written, the credit may go instead to men who hold 75% of senior leadership decision-making roles in health. And even though they are a minority in the sector, this particular project is very much based on recognizing women's contributions. In fact, the process of erasing women's contributions during the pandemic has already started in some places. Women make up 2/3 of more than the 40,000 volunteer health workers who traveled to Wuhan, the city in China where the first outbreak really hit hard, and 90% of the nurses in Wuhan were actually women. But as history has been captured, the most recent documentary that captures the history of the pandemic in Wuhan, the Wuhan Heroes in Harm's Way, we noticed that again, the documentary focused on a line of men forming and no women. And so we have to make sure that as history is getting written, that we recognize women's contributions. So at Women in Global Health, our vision for the future global health leadership is that yes, COVID-19 has changed the world profoundly and exposed the deep inequalities, but we also have an opportunity to build back better and really look at our social economic health systems and create a new social contract so that we truly can have this vision of equitable leadership in global health. First, we are really calling for changing the narrative and seeing women as drivers of the global health, especially nurses and midwives, not solely as users of health systems, but the ones that are providing the critical care. They are creating the resilience in our health systems. We must have history that is recording and celebrating and not erasing women's contributions to the pandemic. Not acknowledging that the default health worker is female means that no priority is given in addressing gender inequality. We know there are workplace policies that are modeled on men's lives. We know personal protective equipment remains modeled on men's bodies, and these are all realities we must address. Second, women in the health and social care need a new social contract. We know that women hold 70% of the jobs in health, but again, they remain clustered into lower status, lower paid jobs, and often unpaid roles driven by gender stereotypes. Women are triply disadvantaged by gender norms that attach lower social value to majority of the female professions, devaluing their status and pay. And again, too often the decisions that are being made about health systems do not include the women. And that also is a means of, again, keeping women at a disadvantage in the health workforce and in health systems. We also know that health workers are exhausted. They're facing mental trauma. Many of the partners on this call have been advocating fiercely for these issues and calling out the fact that we will wake up to a drain of our global health workforce, many of them women leaving, especially because of the trauma that they faced in COVID-19. So this is a time that we need to act and really encourage our sector to provide decent jobs for women in the health and social workforce. Third, COVID-19 has showed us that viruses do not respect borders. It's an interconnected world. High-income countries do not have a monopoly on health wisdom, and we really need to rebalance the geography of power and leadership in global health. And that is why we're really excited that our list has spanned over 50 plus countries from around the world. And today we will be honoring women nurses and midwives from every region in the world. And fourth, beyond gender parity in global health leadership, we need leaders of all genders. This must be the business of all genders to be gender transformative and challenging power and privilege and really creating trust to promote strong, resilient health systems. Women in health, especially midwives and nurses, want the opportunity to deliver better health for all. So as I kick off this event, we will be focusing on the 100 plus outstanding nurses and midwife leaders that we recognize in the context of the year of the nurse and midwife. Yes, the year was 2020, but the campaign and the initiative has sparked the call for greater transformation of both fields and overall the field of health and social workforce moving forward. The women we recognize symbolize the millions of nurses and midwives as all our outstanding leaders, especially those that are working in some of the toughest realities today. We hope to inspire you today, and we hope to continue to recognize women leading at the front lines, and we hope to inspire you to commit action. Yes, applause is great, but we must turn this applause into action today and for days to come, as the calling to support our health workers is now. So on that note, I'd like to turn to our first keynote speaker, Elizabeth Ero. She is the Chief Nursing Officer at the World Health Organization. And before joining the World Health Organization, Elizabeth Ero has a long career. Particularly, she has experience working over 30 years at Cook Islands and regionally as the Secretary of Health at the Cook Islands. She implemented health reforms to strengthen the country's health system. And for the first 25 years of her career, she was a staff nurse, midwife, and charge midwife at the hospitals in the Cook Islands and New Zealand. Welcome, Elizabeth.
Thank you very much. First of all, I would like to express a warm welcome and greetings to you, Ropa and the women in global health and our colleagues from the International Council of Nurses, the International Confederation of Midwives, United Nations Population Fund, Nursing Now, and of course my colleagues from the World Health Organization for the collaborative efforts to ensure we truly acknowledge and celebrate the International Year of the Nurse and the Midwife by recognizing the contribution of nurses and midwives to achieving global health targets. I want to extend greetings to our panel of speakers and to all those who are connected online from around the world, and a special greetings to those linking in from the most diverse locations and also in those challenging time zones. Today, we pay tribute not only to those nominated plus 100 outstanding women, nurses and midwives, but to all women nurses and midwives who have transformed the way health actions are organized and how healthcare is delivered in their countries, and making significant contributions to universal health coverage and the SDGs. In a world where gender and equity are deep roots of several problems, recognizing not only the work of these nominated outstanding women, but the history of their personal and professional life that each one has walked is memorable. To now recognize and celebrate them, and to hear and read the stories of their amazing leadership journeys emerging from different experiences and different backgrounds and their realities is powerful. The word recognition comes from Latin and means know again, recall to mind. And their narratives will definitely inspire and may cause others to recall memories of all that we can do and accomplish. It is truly timely and important to celebrate these women and their different stories of leadership to remind us of what more we can do. Chimanda Morsi Adichie is a Nigerian writer and she speaks of the danger of a single story when only a single perspective is told several and thousands of times, and we believe that this is our reality. She mentioned how impressionable and vulnerable we are in the face of story. However, vulnerability is an important path for transformation. Recall to mind, recognizing these stories is a powerful tool for our identities as health professionals and for reinventing our professional life to better inspire and lead generations of nurses and midwives to fully perform their role and advance their knowledge to strengthen nursing and midwifery in general. What an incredible moment of recognition and representation. There were major expectations at the end of 2019 as many of us started to prepare for 2020, the International Year of the Nurse and the Midwife, anticipating the opportunity to raise the profile and status of nurses and midwives and to leverage for an investment in the professions. The tremendous challenges and devastating impact of the COVID-19 pandemic were not predicted, and COVID-19 exposed many inefficiencies in our health systems and our vulnerabilities as we responded to the pandemic. With nurses and midwives making over 50% of the health workforce, the statistics shared some shocking but may not be surprising realities. Around the world, about 14% of all cases of COVID-19 occur in healthcare professionals, reaching up to 35% in some countries. The risk of infection compared with people in general community was 3 times greater, even after taking differences in testing into account. Additionally, the physical and mental health burden associated with COVID-19 in healthcare workers is high, particularly in females and nurses. It's impossible not to remember the thousands of lives lost in this pandemic. Despite the challenges posed by the pandemic, in 2020, we launched the first ever State of the World's Nursing Report. We shifted to a virtual mode and supported our global nursing and midwifery community through this modality. With the State of the World's Nursing Report, the State of the World's Midwifery Report to be released soon, and the next iteration of the Global Strategic Direction for Strengthening Nursing and Midwifery, we can together really strengthen our advocacy efforts through good data and evidence and sound policy options. There is a substantial body of evidence that points to the effectiveness of nurses and midwives in contributing to the healthcare delivery across a wide range of services, from sexual and reproductive health, maternal and newborn and adolescent health, to communicable and non-communicable diseases, including health promotion, prevention, curative and rehabilitative and palliative services, and also in emergency and disaster situations. The report delivered by women led by men, found that women make up 70% of the global health workforce, yet only 25% of the leadership positions in health. We understand these gender leadership gaps are driven by stereotypes, discrimination, power imbalances, and privilege, and we have more work to do in this respect. For the nursing and midwifery profession, there is a varying presence of leadership at the senior most level in governments, and their voice is either absent or weak. This is a crucial position to both effectively manage the national nursing and midwifery workforce to maximally continue to contribute to population health, and also to introduce or incorporate their perspectives into health policies and decision-making. I believe the stories and the leadership of these plus 100 outstanding women nurses and midwives will add to our basket of knowledge and wisdom to build leadership capacity in countries and organizations. I want to add to this basket. Within WHO, a small but increasing number of nurses and midwives from our headquarters in Geneva and our regional and country offices have an established WHO task force on nursing and midwifery, with an aim to provide an interdisciplinary platform to strengthen, mainstream, and make visible the contributions of nursing and midwifery perspectives into WHO guidelines and standards, and to strengthen the capacity of government chief nursing and midwifery leaders and all nurses and midwives in countries to deliver on their roles and responsibilities. I believe that as we continue to collaborate, partner, mentor, nurture our next generation of nurses and midwife leaders through the sharing of our products and experiences from 2020, we have a tremendous opportunity to leverage for the investment case in nurses and midwives. It was also the year of the nurse and the midwife festivities in 2020 that acted as the lamp that illuminated our toughest days and inspired us by stories, challenges, campaigns, and activities that we dared to persist. The lamp from Florence Nightingale was alive, and it lit up between us, reminding us how much the science that she pursued and proven is the foundation and evidence of nurses and midwives' work. This website, I believe, features the incredible target of plus 100 remarkable women and leaders. Please visit the site. Although we know that despite the historic benchmark, plus 100 still represents how scarce our leadership possibilities are. The number of nurses and midwives with seats and real decision-making power in government offices is also negligible. It is not a complex account to be made, but it is certainly a complex one to be overcome. It is time to remind governments and employers that accolades and applause for nurses and healthcare workers is not enough. Governments and employers must make the investment in strengthening nursing leadership, quality education, and decent work conditions. To conclude, I want to congratulate our plus 100 outstanding women nurses and women and midwives on this occasion, and I look forward to recognizing more on this platform. The diversity of this group of women nurses and midwives from their geographical, cultural, and lived experiences brings many stories of nursing and midwifery to the forefront. We have much to share and learn from each other. The danger of a single story would give voice to the power of storytellers. Stories of life, of bravery, of failures, of courage and resilience. Stories of science, evidence, data and research. Stories of the practicality and humanity of nursing and midwifery. Real stories that impacts and makes the difference. I believe these amazing stories carry the symbolism of the Florence Nightingale lamp and encourage the changes that each one is capable of making with courage and knowledge. Let's listen. Thank you.
Thank you, Elizabeth. And it was, exactly your key word there, let's listen. And so I'm going to turn it to our next speaker who is sending us a warm message. This is we're going to be receiving a video message from Miss Etie Rosenberg. She is the Deputy Executive Director of Programs at UNFPA, and I'm going to turn it to Jenny Martin to just upload the video message, please. Jenny, I'm not able to hear the volume.
I'm honored and excited to speak at the launch of the Year of the Nurse and the Midwife 100 Stories website. As a proud global leader to strengthen midwifery, UNFPA applauds women in global health for having invested in recognizing the enormous contributions of midwives and nurses to the health and well-being of women and families around the world. We know midwives and nurses contribute to the health of women, families, communities, and society at large, but the impact of their care goes much further. In the language of the Global Strategy for Women's, Children's, and Adolescent Health, their care is transformational. Respectful care, always putting the person in the center, active listening to women and focusing on strengthening women's own capacity to care for themselves, their family, and their community, transforms lives. Such approach enables women to improve their position in society, their decision-making power, their income levels, and ultimately their influence and power. Our recent article on the impact of midwives shows that universal coverage of midwives delivered intervention by 2035 can save over 4 million lives per year. Even a less ambitious coverage increase of 25% per year can save over 2 million lives annually. Core to this achievement is a midwifery workforce that is educated, regulated, but also well supported so that they are able to work to their full professional capacity. Midwives and nurses in leadership positions are able to make informed decisions to increase access to quality midwifery and nursing care, especially in low and middle income countries. These decisions empower their colleagues in all professional groups across the health system, care seekers, and ultimately society. It contributes to encourage government, decision makers, and organizations to further invest in midwives and nurses. We must work together to ensure midwives and nurses are empowered and in decision-making at all levels, especially so they can protect the interests of the women and the girls. Thank you.
Great. So that's a wonderful message that we received from Ms. Etie Rosenberg. I'd like to invite our partner of ICM, Dr. Franca Cadna. She is the president of the International Confederation of Midwives. Franca is an expert on midwifery and an advisor on international maternal health with over 30 years of experience in strategy, policy, working in advocacy and leadership, project management, and partnership. She is the current International Confederation of Midwives president, but I'd also like to say that Franca is one of the most humble and fiercest advocates for all women, and especially for women in midwifery. So Franca, I turn it to you.
Of course, I need to unmute myself. Thank you so much for that, Rupa. Thank you so much. And thank you to Women in Global Health for adding a jewel in the crown of the Year of the Nurse and the Midwife, because this is what you're doing. And we know that WHO has designated 2021 as the International Year of the Health and Care Workers in recognition of our dedication to provide care during and despite the COVID-19 pandemic. And so midwives and nurses are still being celebrated because, as Elizabeth said, we constitute 70% of the healthcare workforce, and that makes me feel very, very proud. I also want to thank Women in Global Health for recognizing that midwives and nurses specifically are distinct and complementary healthcare professionals, and women healthcare workers are often heaped together as low-paid, flexibly deployable worker bees. And we are very, very hardworking as autonomous midwives, as autonomous nurses, and appreciating our difference as professions is a part of our emancipation and will support us to give better quality care to the communities we serve. It feels such an honor to stand with the midwife and nurse leaders on this list, and to all those women healthcare leaders out there that are not on this list. That does not make you any less of a leader, because we stand here today as a symbol of all the women healthcare workers who lead, yet are not always seen or recognized for doing so. So I want to thank every single one of you. And you could ask them, what makes a midwife or a nurse a leader? Well, I think that leadership is truly innate in our professions. Midwives and nurses are dedicated, we're passionate, we're perseverant. These are all important qualities of a leader. And added to that, I think our marginalization as midwives and nurses, it instills a kind of ferocity. I think that's what you were referring to, Rupa, possibly, in what I sometimes do. But there is a certain ferocity that compels action and it pushes for change. And that really makes me feel, again, very, very proud. And the leaders on this list have many different leadership skills, such as speaking up with confidence, uniting others in one voice, daring to show their true selves, working as a team, recognizing others, leading with passion and purpose, and not giving up. And one thing that became so obvious to me while the list was being composed and I was familiarizing myself with the work and the lives of all the people on the list was the amount of unpaid many healthcare leaders juggle with their paid work. And this is also the case for women in general. I know it's the case for some very well-known global women leaders that they do a lot of unpaid work as well. And in many of our societies, the most obvious way of demonstrating our appreciation for someone's work and leadership is through their pay. And even though women's representation in the most highly paid health occupations has been improving since the year 2000, there is still an average gender pay gap of about 28% in the health workforce. Now, interestingly, this percentage is often brought down. Some even say it's only 11%. And I could kind of accept that analysis better if we were more explicit about paid work and unpaid work, because many of us have paid and unpaid work. Many women leaders lead without any financial reimbursement at all. And we also need to be aware of all the institutional biases that create huge barriers for women to be recognized for their unpaid labor in the home, in childcare, and for society, as well as when they want to choose to access full-time employment with equal pay. This will be the case for most of the 100 midwife and nurse leaders on this list. I'm sure that many of you will recognize this. And I would like to share an example of one person on this list that I have the privilege to know well. And I have a permission to share her story. And I'm certain that, again, you will recognize yourselves. I certainly recognize myself in her leadership story. And this is the story of a midwife called Betty Sam. Now, Betty Sam is a colleague midwife. She's a midwife from Sierra Leone. And it took me a while to understand her family structure. She has so many children. They're a very wide age range. And only one of them is her biological child, but they're all her children. Now, Betty runs financially supports a large household. She also supports people within her church community. She stands with her family and friends. She travels several days to help others, and that's just everyday life. That she finds that quite normal. Betty Sam is a leader in her midwife community. She's played a significant role in uniting Sierra Leone midwives and to support them to be seen by the ministry and the society, to have impact on the autonomous profession as midwives. She does all these things with full dedication, and everything I've mentioned up to now is voluntary. None of this is paid work, because I haven't yet started to describe Betty's paid employment. Betty also works full-time to support the education of midwives in life-saving skills and emergency midwifery care all over Sierra Leone. Now, this is what I call leadership, and it makes me feel terribly, terribly humble. Thank you, Women in Global Health. Thank you, Rupa, for giving women leaders in global health the attention they deserve. And thank you to all women leaders out there for all the leadership you bring in your paid and your unpaid work.
Thank you, Franca, and especially for really highlighting the issue of unpaid work. We know that during this pandemic that women are doing so much unpaid work in their households, in their communities as care workers, but we also know our women in the health workforce are asked to do beyond. And sharing that story of Betty was very touching. So on that note, I'd like to invite our next partner, Annette Kennedy, who is the president of the International Council of Nurses. Annette also has been dedicated for decades in advocating for women and especially nurses. She also serves as a board member of the Nursing Now campaign, and she brings experience of working on professional development for nearly 20 years, and has experience particularly with the role of education research as well. So Annette, the floor is yours.
Thank you, Rupa. And thank you, particularly Rupa and all your team for today and for developing this awards ceremony for all the nurses and midwives out there. I thank you for that. I thank you for recognizing the work and the leadership of nurses in the Year of the Nurse and the Midwife, and particularly during the pandemic, but also for providing a platform for women's voices in global health. It is so needed today more than any day. For me, this award is about the nurses that I have met across the world, the nurses who see themselves as ordinary, but do extraordinary work in challenging and difficult circumstances. The nurses that I have met are working full-time. They're homemakers, they have families. They're probably looking after elderly relatives, and they're trying to support nursing organization to make things in the socioeconomic welfare for nurses better, and to make things better for patients by increasing the education and the competence of nurses. Those are the leaders, those are the real leaders that I see. As we said, 70% of us are women running the health service across the world. No health service can exist without women. Nurses make up 60% of that. And of that 60%, 80% or 90%, closer to 90% are women. So we run the health service as women, but I am worried. As Elizabeth said, according to the World Health Organization, the report of the state of the world's nursing said that we are 6 million nurses short, 5.9 to be exact, but closer to 6. Our own ICN research indicates that in the next 10 years or less, 4 million nurses will leave the service through retirement, mainly in North America and Europe. Tied to this, our own national nurse associations have told us that many nurses are suffering burnout, post-traumatic stress. They are suffering from physical and mental exhaustion, and they have seen so many of their colleagues die and so many patients die, and they have been with them when they are instead of their family and instead of their loved ones. And they plan to leave. Many of them plan to leave. We are worried because even if a small proportion of those leave, we could be looking at 50% reduction in our nursing workforce. And I wonder, governments are voicing nice platitudes to healthcare workers, and particularly to nurses, but I have seen no action. I have seen no investment. I have seen nothing to protect or support or retain nurses. In December of this year, ICN did research in 59 countries that showed that 2,700 nurses had died. We know this is an underestimate. We know that many millions have suffered COVID positive symptoms, and many of those will have long-term effects. The priority for us right now is vaccination for all healthcare workers, and particularly nurses and midwives across the world who spend so much time with their patients in all areas of the health service, from community to hospitals to long-term care. And we know that many patients have died in long-term care through lack of protection. Today, we are working with WHO signing the Vaccine Equity Declaration because it's a moral obligation for every country, protecting healthcare workers, protects patients. It is the only way. Governments have invested billions in controlling the pandemic, but are they willing to invest in healthcare workers? I'm not so sure. I'm not so sure they have learned lessons. I worry about that. Nurses and midwives and all healthcare professionals, particularly women, have been instrumental in saving lives and consequently saving the economy. It is essential for us that the proposed strategic direction for nursing and midwife is implemented and that we have to hold governments to account. And nurses, by virtue of their role in all areas of healthcare, their unique knowledge of patients, families and community, have expertise that is not just of benefit, but is essential to the current pandemic. And yet, they're not visible. They're not visible in global or national COVID strategy, in steering groups, in task force, or in media briefings. Nurses are always the implementers, but never the decision makers. The world needs the involvement of women. We can't have a health service without women. And nurses see themselves, as I said, as ordinary. But without the nurses doing extraordinary things in these challenging times, we will not have a health service. These are the real leaders. So for us, it's from silence to voice. We have been too long silent. Thank you, Rupa, and thank you, Women in Global Health, for all you do.
Thank you, Annette, and really thank you to ICN and all the nurses around the world for everything that you do. And you just really reminded us how much we need to go to our governments and really demand that, you know, they turn that recognition and applause into real action and investments. And not only is this the right thing to, but it's dire right now. And we will be sharing more about the vaccine equity initiative. And thank you for announcing that as well, because that is something that all of us really should be a part of to make sure that all health workers are prioritized in every country to receive vaccines. On that note, I'd like to invite our next partner, please welcoming Dr. Barbara Stillwell. Dr. Barbara Stillwell also brings decades of experience of really championing for health workers and strong health systems. She is the Executive Director of Nursing Now, and before joining Nursing Now, she was IntraHealth's International Senior Director of Health Workforce Solutions and recently served as Director of a Health Workforce and System Strengthening Project in West Bank and Gaza. And Barbara, you also have a long history of investing into education as well. So I invite you to the floor.
Thank you so much, Rupa. And it's wonderful to see colleagues here on my screen in my snowy study here in England. Thank you so much to Women in Global Health for this wonderful opportunity for nurses and midwives. And who could ever, in thinking about this event, I've been reflecting on the Nursing Now campaign, which has been extended 6 months because of the pandemic. It should have ended in December, but it's not going to end till May. And I've been thinking about all the firsts for nurses that have been going on during this time. The Year of the Nurse and the Midwife, which was a first for nurses and midwives, I think I'm right in saying, Franca. State of the World's Nursing, which was a first for nurses, although we have had State of the World's Midwifery on a few occasions. Thank goodness we've caught up with the nurses now, and we have a first State of the World's Nursing. The Nursing Now campaign itself, you know, the first time there's been a global social movement enabled by technology that's brought nurses together around the world. And as Howard Catton of ICN has said on some of our webinars, we've become actually even more global because of the pandemic, because every single meeting we have is a meeting for the world, because we can be connected as we are today. So there have been so many firsts, and what I've also learned through this is that we have become better at working together. And And I think that that is really critical, because I think as nurses, we can too easily, and midwives, I'm sorry, though I'm not really speaking for midwives, but it's an observation. I think we can easily become kind of siloed into our special areas and not talk to other people, let alone, Rupa, talk to medical doctors. And I actually do think that's the future. You know, we need to be thinking about how we come together through, for example, such common interests as women in global health. And I'm often quite disappointed to see there are not many nurses and midwives on women in global health, not as many as I'd like to see, more midwives than nurses, but I'd love to see more nurses on women in global health. So all these firsts plus a pandemic, where does that leave us? And, you know, there's a lot of really gloomy news, isn't there, at the moment? But something else I've learned through this campaign and through the last year is there's a whole generation of young nurses who are all waiting to step up and be the leaders they can be. And that is just wonderful. We have got, wait for this, 30,000 young nurses who want to be Nightingale Challenge, what will become Nursing Now Challenge, students for leadership to be developed, 30,000 around the world. And the ones that we have already brought together have stayed together because they've got WhatsApp and they can be a group on WhatsApp and share what they're doing. And more heartening than ever, congratulate each other on what they're doing, encourage each other, make sure that, you know, they're all feeling good. And we've had a few examples where people haven't felt good, but the nurses, the young nurses on that group have stepped up to support them. That's been fabulous. And the other thing has been the mentoring and the development of young nurses by older nurses. And I want to just have a big shout out for Sigma Theta Tau in this. I've been working with Liz Madigan, who's another great leader who's been on our list, who is such a humble leader and such a really great example for young nurses, and has really encouraged groups of these young nurses on the challenge to step up, to be heard. And on our webinar a couple of days ago, we had one of the Sigma Theta Tau nurses on that program who joined us, although for this nurse it was 3 a.m. But they still joined us and made an input. So how wonderful is that? Every leader needs to create another leader. And that's a mantra that we should be taking with us from here. The 100 who are here on this list will bring another 100 next year, and they will bring another, and we will grow. We'll grow like a virus exponentially. And that's what we need to be doing. So although Nursing Now is coming to the end, as one of our great British leaders said, I see this not as an end, not even the beginning of the end, but the end of the beginning. We're at a beginning. We're at a beginning of a new story of nurses and midwives and women. It's time. It's our time. Nurses and midwives are mission critical, as Annette was saying, to the functioning of health systems. It's our time. We're ready. We've been ready for years. Now it's time to step up. Thank you, Rupa, so much, and thank you for this recognition.
Thank you, Barbara. And in your words, it's our time, and it's the time for women, and it's a time for nurses and midwives and all health workers. And on that note, I am going to invite our first speaker, who is going to be sharing her story and has been recognized in the 100 plus outstanding nurses and midwife leaders. So on that note, I'd like to introduce Etie Rosenberg. She is from Israel. She is a policy nurse leader who is finding new ways to tell the story of nurses through the media. Etie has helped to facilitate the Khalat nursing community on Facebook, which stemmed from the tragedy on the day that Tova Karo, a nurse at Khalat Clinic, was burned to death by a patient. So Etie, to you to share your inspiring story and how you've taken tragedy and really turned it to something transformational.
Thank you for the wonderful introduction, and thank you, Women in Global Health, the World Health Organization, the United Nations FPA, Nursing Now, ICN, and the International Confederation of Midwives for this great event. And of course, thank to my family for all their love and support. I'm humbled, honored, and excited to be featured on this list of outstanding women nurses 2020. Each of my fellow nurses here is a true beacon of inspiration and someone to learn from. When I was 19 years old, my father, Arye, who's watching this webinar with my mother, suggested I become a nurse. He believed not only in the compassion of being a nurse, but he was also a practical man. He knew that as a nurse, I will always be able to find a job. This has been true ever since Florence Nightingale established modern nursing. I signed up for nursing school and my journey began. I have found nursing to be the ideal profession for me. Everything I did impacted human lives in a profound way. It didn't take long till I was spotted for leadership role. I was and still am an opinionated, outspoken person. I chose the road less traveled. Whether it was in a hospital setting or community, I was constantly accepting challenges. The secret is the pride we take in everything we do. Every day I remind myself why I decided to become a nurse. Treating patients with HIV in the 80s, helping women struggling with infertility in the 90s, and managing nurses and caring for nurses for the last 2 decades. Like many women nurses entrepreneurs, I faced rejection, but I never felt like quitting. Several years ago, we lost Tova, a nurse in the Tel Aviv community district. A patient had set her on fire. As she finished drawing his blood sample in the morning, this 78-year-old patient, whom she knew very well, ended her life. Tova was one of the finest community nurses I have ever known. This veteran and much-loved community nurse was the neighborhood queen. Everyone knew her name and everyone felt free to ask her anything. As I was comforting fellow nurses the following days, I realized they were not only grieving losing Tova, a friend and a colleague, they were also grieving the fact that we nurses were not being heard. That's why I decided to tell our story through social media, to admin a Facebook nurses group and shed light on what it is that we do. Even though the initiative was very unconventional, I received nothing but great support from the Clalit Health Organization, which has been my professional home for over 20 years. Mrs. Adva Evan Shoshan, the head of social media, the chief executive nurse, and the CEO of Clalit had my back 100%. The community has become one of the most meaningful Facebook groups in the country. Thousands of nurses checked in at least once a day to see what's new, sometimes even before their morning shift while commuting to work, and other times at 2 a.m. on their 5-minute coffee break. It's a very diverse community. Members come from various backgrounds, hold different religions, come from cities and rural areas, young and retired, and they have started sharing posts in the group in rapid succession. When the pandemic hit back in March 2020, like with everyone around the world, we were stressed, worried, and afraid. During that time, our Facebook community not only did not perish, it flourished. Members of the group used it as an outlet all year round. It didn't take long before nurses began writing their COVID diaries, sharing the experience of being the last person to hold the hand of a dying patient with no family around, a quiet death. They were sharing the many hard moments of their job, but still maintained the complete dedication to the global mission. I commented on each and every one of these tens of thousands of posts, encouraging and thanking each and every one of these brave nurses. After all, we are nursing the world to health. As the year came to an end, we collected the diary entries into a book, which was sent to the printers, so every nurse could get a copy and share it with their family and friends. As we are currently all preoccupied with the third wave of COVID, we are also vaccinating the country. I see nurse managers lead by example by being part of the vaccination workforce during weekends and night shifts. It doesn't matter how many years of experience and expertise you may have. It's a team effort, and we mentor each other. A word of advice to the younger generation: look for a nurse that inspires you. Let her know that you look up to her and that you are learning from her at every move. My role models have been my guide throughout my different career path. Professor Handel, the dean of my nursing school, followed by Dr. Wise, Clalit former chief of nursing, and Mrs. Perlman, Clalit current chief of nursing. I am also truly inspired by Dr. Goldberg, the Israeli national head nurse, who made it a priority to connect all nurses, understanding what we can do together in delivering our values and stories through social media. Compassion, persistence, and discipline were always the nursing professional's special qualities and will remain so. But don't give up on your voice. Speak up, express your idea, and never miss an opportunity to sit at the table where the decisions are made. I dedicate this honor to all my fellow women nurses as we all vow to be there for humanity. You are all women of worth. Shalom from Israel.
Thank you, Etie, and that's such an inspirational message that you have shared, and some really concrete words of wisdom, and how you've used communication and media to get the message and the voice of nurses to really go beyond where they are now. So thank you for joining us today, and please stay in touch and keep up the important work. On that note, I'd like to invite our next midwife leader. And we are going to be transitioning to video. Her name is Shukriya Safarzada. She is a midwife and teacher at the French Medical Institute for Children and Mothers in Kabul, Afghanistan. She has joined us virtually and is here live as well, but we will be watching her video message first. In Afghanistan, she aids in the safe delivery of newborns, improving the odds of survival for many of her patients. Jenny, turning it to you to just start us on the video.
Hello, my name is Priyam Safarzada, one of the young midwife and nurse leader from Afghanistan. I always had a challenging life since I was born in 1990 during the civil war in Afghanistan, and experienced hardest living moment of my pupil in poverty and insecurity, losing their parts of body and loved ones in explosions, also immigrating to other countries. After collapse of Taliban regime, my family decided to settle back to our country after years of being refugee in Pakistan. During my bachelor studies in business administration, I faced with a shocking news about maternal mortality rate in Afghanistan. I read that in 27 minutes, a young mother lose her life due to the lack of supplies and service shortage of midwives needed for delivery in the hospital and rural area of Afghanistan. I stepped forward to become a midwife to be a change I want. After I received my diploma in midwifery, I started working as a midwife in private hospital. Later, I joined Rabi Balkhi, the well-known largest and biggest public hospital of the country, for a better change, and that's why I chose midwifery. During my studies, I got the chance to interact with more people and realize the major issue of my society. I found women to be oppressed and ignored in my society. Therefore, as an educated woman, I became passionate about activities that could help women in a conservative society like Kabul. I used my personal skills, wealth of knowledge and experience to achieve my goals with the help of other midwives in a common shared value team. In governmental hospital, I and my fellow were taking part in 30 up to 60 deliveries each night with a huge responsibility and stress, which was the matter of saving life of a newborn and the mothers. There I realized that the midwives are at the front line to fight against the rise of mothers' mortality rate. After 2 years of my work and bring too many managerial changes in governmental hospital, I plan to join FMIC, which was the most standard hospital in country, and I did my best to become a head nurse there. And successfully, I could cover 6 critical areas like OT, recovery room, resuscitation rooms, labor rooms, and triage room. With my skillful team members for the last 3 years. Considering the hard work of all midwives in the challenging conditions and with many social distractions for women in Afghan society, we must acknowledge them as the heroine of Afghanistan. Understanding that I have selected the right career path, I was always inspired to keep up with my work and help women to improve in my country. All my dreams come true by the support of my families, especially my dad and husband. During COVID-19, it was very hard to manage and work in my community where insecurity, poverty, and lack of health facility rate are very high. Majority of people and healthcare staff were facing too much difficulties for lack of health service centers. Me and my team were also facing issue in volunteer jobs to facilitate healthcare system and transfer public awareness to uneducated people. But fortunately at FMIC, everything was good. The rapid serious security threat in the Kabul city plus increasing of death due to COVID-19 intensified our concern. Further, daily explosions and suicides attack on public centers and healthcare staffs, and seriously on a maternity hospital in Dashtibarchi, Kabul, where midwives, mothers, and even newborn babies were shot and brutally killed, and it was broadcasted widely in social media and news. At the end, my advice to myself and to other midwives leader is, when you save a life, you save a world entire. Thank you.
Thank you, Shukriya, for such a powerful story and how you are taking on gender norms in your cultural context and inspiring all of us. On that note, I'd like to invite our next speaker. She is a midwife. Her name is Deborah Lewis. She's a regional leader. She's a regional leader in Trinidad and Tobago. She was the founder of the Caribbean Regional Midwives Association and has worked extensively with ICM. She is sitting on the board and is serving the post as vice president. She's also currently a co-chair of ICM's Scientific Program and Planning Committee. Welcome, Deborah. The floor is yours.
Thank you. And thank you to the partners. This really is such an honor to have been nominated and then eventually chosen. My journey to midwifery began as a child when I accompanied my mother to the local hospital as a Red Cross volunteer. She was a volunteer. And I saw the work that the nurses were doing. And it just made me really want to follow that profession. However, during nursing, when I had the experience in the maternity area, I saw a moment when women were so vulnerable and yet so powerful that it made me feel that this is the area that I wanted to practice in. And so I chose midwifery because it gave me an additional level of autonomy. I also jokingly say to people that I knew that wherever in the world I chose to live, I would be able to practice, because women would always be having babies. I would describe my journey really as adventurous, and it did not start as a personal or an individual journey at all. It started because of what I saw as a real lack of recognition for midwives and midwifery, particularly in this region. And so that's what started my involvement with establishing national and then a regional midwifery association. And of course, my ultimate engagement with the global body for midwifery, the International Confederation of Midwives. And although this certainly gave midwives more visibility in the region, and it allowed us to be present at the table and to contribute in a more meaningful way. There were still several barriers, and the biggest one, I feel, continues to be the lack of respect and the lack of recognition and the lack of support for midwives. There will always be a core group that supports you, and that's important, but sometimes it can get a little bit discouraging. However, if you really have a passion, which I do, for my profession and for the women and their families, then you keep going. In addition to the core group, which I had, you also have mentors. And, you know, one of my mentors, Venus Mark, I will remain eternally grateful. And the support of those people is immeasurable. But I also feel that it's the clients and the students and the young midwives who maybe with just one or two words that they don't even understand the impact that they're having, but they come just at the right moment or just in the nick of time to keep you going and to remind you that you can do it. During the COVID-19 pandemic, I was able to contribute to our national healthcare system response and also areas. However, I feel that the most impactful contribution I've been able to make was as a UNFPA consultant, where I supported the Regional Midwives Association to offer monthly educational webinars. With any new infectious process, there will be a lot of fear. And of course, there's constantly evolving information. And we were able to ensure that the information that was presented is from credible sources, but also that there was a global and a regional perspective involved. And this really allowed the midwives to continue to provide evidence-based quality care, still ensuring that it was respectful. But it was also important for us to make sure that the providers themselves were adequately protected so that they had current information to work with. In terms of the future midwifery leaders, I just would want to say to have goals, dream big, do not be deterred. The journey is sort of like always be obstacles in different forms, but we have to learn how to navigate them and always remain to opportunities. If you're going to walk on thin ice, you might as well dance. So I just want to passion and dedication, but absolutely make sure that you enjoy the journey. Dance through your journey. Thank you.
Thank you, Deborah, for just such great examples from your career and how you keep the hope and the positive energy around you. We do have to be hopeful in these challenging times. On that note, I'd like to invite our next leader, who is a nurse from Cambodia. And Chodra is a nurse who is a pioneering women's health work in Cambodia through a women's health outreach service at Morsi Medical Center in Cambodia. So Chodra Yan, the floor is yours. Welcome.
Hello, My name is Choda. I am a nurse and I head of our women health department in Morsi Medical Center. Today, I'm very excited to join the outstanding of the Women Nurse and Midwife Leadership of 2020. For my experience and my history is more related to women health. And the thing that I decided to choose to be a nurse because I think I can take care and serve the people life, and especially I can take care of my family and my child too. Because now I have two child, and the first child is like he have abnormal anorexia, so he got surgery since he was born. So at that time, to make me very excited to become a nurse because I can do more care to him and I can help experience and I understand how to take care of him and prevent him from infection or something. For my workings, I have been working as a nurse for 10 years. I have worked in OPD, IPDs, and surgeries. Now I am a head nurse of women's health department for last 2 years. I really love my job and my department and my team. I have been working hard for my new department. It's not really just taking care of the patient, but I work in the office to do like administration, like keep track of the patient chart, and like because of my department like is the growth of the women health. So it department is just help for people and have doctor, me and another doctor. So like I need to prepare everything for the new department too. I work as administration in office, preparing the women chart and making it easier for follow up for the women who have abnormal because we always do VIA to the patient. So if the patient that have VIA positive, we need to follow up them and keep close to them because all of them feel like they not complain about women health, like she know any complaint, so she don't want to come back, but we still encourage and continue to keep track with them to follow up with us too. And I keep all of the result and schedule a patient for follow up and make plan for our team, doctor, nurse, assistant, and spiritual and pet team for us monthly outreach with a Google document, communicate with any organization because my department will related to our other organization to make sure the patient from rural area they can come and join to like screening for pre-cancer for the women in rural area or like the people that they never know about the cervical cancer. So I also have the organization support the ministry with preventive health training to trainer, education, and training of NGO staff job in the center. I also part of the partner health program in Cambodia that encourage awareness of cervical cancer, provide a least screening and effective treatment. Even cervical cancer in Cambodia is the second cancer among other women in Cambodia. However, this disease almost 100% is preventable, but it's difficult for the women of Cambodia because the screening of cervical cancer to prevention of cancer. Like I talked before, it's like they not complain anything, they don't know, so they want to come. So it's like we need to push them to visit us, and like if the women that they have like positive or something like that, we will give one treatment around the time that they come to visit. Yeah.
And Chodra,
And
you're doing so many great, wonderful things and roles, and really showing like the impact that as a nurse leader in especially issues that are often neglected, such as cervical cancer. What would be your closing message to us as we hear about your wonderful story here? What one advice would you give to everyone tuning in about leadership?
Yes, for my women and nurse and midwife, keep working hard and continue with compassion to prevent and to stop the cervical cancer for the women in the future. Like we work with heart. Okay.
Great.
And at the end, I would like to say thank you to Medical Center and my director, Dr. Judy, that she is my director department, and I also thank you for the organization of Women Health Global event invite me to join this program.
You are most welcome, and it's a privilege for us to hear from you. Thank you, Chodra. So on this note, I'd like we will be hearing from one of our again, nurse leaders from Korea. Her name is Miss Choi Young-suk. She has recorded a video message for us, and her colleague is live joining us at the event. Miss Choi is a vice president of the Kim Young University Donsang Hospital. She has decades of experience in nursing and hospital management and has been working at the front lines, leading the nursing department as being the first COVID-19 treatment hospital in South Korea, both providing invaluable understanding and containing and preparing the nursing departments across the country for the virus. So Jenny, if you could please start Miss Choi's video.
원장님은 왜 간호사가 되기로 결심하셨나요?
네, 8살 때 동네 친구들과 놀다가 손등이 굵은 철사줄에 찢겨서 병원에 가게 되었습니다. 피가 나 무서워서 울고 있는 저에게 많이 아프지? 괜찮아. 예쁜 손 잘 치료될 거야. 라며 따뜻한 말로 위로해 주신 간호사 선생님 덕분에 마음의 안정을 찾았고 수술도 잘 마칠 수 있었습니다. 제가 치료를 위해 병원에 갈 때마다 그분은 웃음으로 반겨워 주셔서 저는 병원에 가는 날을 기다리기도 했습니다. 그분을 보면서 나도 사람들에게 위로와 도움을 주는 간호사가 되는 꿈을 가지게 되었습니다.
원장님의 리더십 여정에 대해서 이야기 좀 해주십시오.
저는 1982년 계명대학교 동산병원에 입사를 해서 38년간 근무를 했습니다. 입사 후 13년간 내과, 외과, 소아과, 응급실, 중환자실 등 다양한 임상 경험을 했고 16년 동안은 케이스 매니지먼트 업무를 하면서 보험 제도와 보상 체계, 병원 경영에 대한 이해를 높일 수 있었습니다. 임상과 행정을 두루 경험한 제가 간호 리더로서 업무를 하는데 큰 자산이 되었습니다. 제가 간호본부장으로 임명이 된 2017년 병원은 1000병상의 규모로 신축 이전을 준비하고 있었는데 저는 이를 간호가 도약하는 기회로 활용했습니다. 저희 병원은 120년 역사의 전통을 잇는 병원이었지만 그 시간만큼 각 분야의 간호가 각각의 업무 형태를 가지고 있었습니다. 간호 기록을 표준화하면서 진료과나 병동별로 특화된 간호 과정을 개발하는 등 간호 전산 기록을 정비하였고 병동의 구조, 물품과 장비, 약품 등을 표준화하여 간호사들이 어느 병동에서든 쉽게 적응해 일을 할 수 있도록 업무의 효율성을 높였습니다. 재단은 병원 신축과 이전을 위한 저와 동료 간호사들의 공로를 인정하여 2019년 간호부서장의 지위를 본부장에서 부원장으로 승격하였고 제가 초대 간호부원장이 되었습니다.
코로나 사태 동안 원장님은 어떻게 리더십을 발휘하셨나요?
2020년 대구에서 코로나19 확진자가 증가하자 저희 병원이 감염병 전담병원으로 지정이 되었고 병원 전체를 코호트 체제로 운영하게 되었습니다. 대한민국 최초의 코로나 대유행이었고 최초의 코호트 병원 운영이라 간호 업무를 총괄하는 저에게는 큰 도전이었습니다. 저뿐 아니라 많은 간호사들이 두려워했지만 코로나 간호 업무에 지원한 간호사들과 함께 코로나 환자를 치료할 준비를 시작하였습니다. 제게는 크게 3가지의 리더십이 있었습니다. 첫째는 코로나19 환자를 치료할 수 있도록 병원을 세팅하는 일이었습니다. 당시 병원은 전쟁터 같았고 아무것도 없었습니다. 그런 곳에 첫 2, 3일 만에 211병상과 중환자실 2병상을 준비했고 한 달 동안 445병상, 중환자실 20병상으로 정설에 운영을 했습니다. 이 과정에서 물품, 입원 간수화 차트, 간호 기록들을 표준화하여 감염병 전담 간호 시스템을 구축하였습니다. 둘째는 감염 전파를 예방하고 간호사들이 번아웃되지 않도록 관리하는 것이었습니다. 저는 간호 인력 모두에게 보호구 착탈 방법을 교육하고 방역 및 감염 관리를 시행하여 직원들의 감염 전파를 예방하는 데 가장 중점을 두었습니다. 또한 전실이 없는 코호트 병원에서 레벨 D 보호구를 착용하고 환자를 돌보는 것이 체력 소모가 많았기 때문에 8시간 근무 동안 2시간씩 교대 근무를 하도록 해 간호사의 번아웃을 방지하였습니다. 이 감염 관리와 근무 지침은 이후 전국으로 퍼져나가 활용이 되었고 대한간호협회의 코로나19 파견 간호사 사전 교육에도 활용되고 있습니다. 셋째는 다양한 경험과 배경을 가진 간호사들이 화합해서 일을 할 수 있도록 하는 것이었습니다. 코로나19 환자가 폭발적으로 증가하자 간호사가 부족하여 전국에서 260명의 자원봉사 간호사들이 왔습니다. 자원봉사 간호사들이 우리 병원의 시스템을 빨리 익히도록 하는 것이 큰 과제였는데 자원봉사 대표들과 주기적인 간담회를 통해 업무 및 교육 프로그램을 개선하였습니다. 지금 되돌아보면 코로나19 환자가 밀려드는 급박한 상황 속에서 휴일도 없이 하루 12시간 이상 근무하는 강행군을 버틸 수 있었다는 것은 하나님과 동료 간호사들을 비롯한 의료진들의 도움이 있었기에 가능했습니다. 이 자리를 빌어 진심으로 감사드립니다.
What a powerful message from Ms. Choi, and the description of working those long shifts and really responding to what was not an organized system and really creating organization. So Ms. Choi, thank you for sharing that message with us and the lessons learned, and exactly shows leadership at work in crisis. I'd like to invite our next speaker, and this is Nila Kilku. She is a nurse and midwife working in Kismu, East Suburban National as the Reproductive Health Coordinator. She is also the Vice Secretary at the Reproductive Health Network in Kenya in the Kismu cluster. And Nila is with us live. The floor is yours, Nila.
Thank you very much for the opportunity. And I want to appreciate Women in Global Health for presenting me an opportunity to share my story. Mine is a story of hope. It's a story of resilience. It's a story of hard work, and it's a story of determination. I come from a community that we don't have that transition from childhood to adolescence to adult. And so once you start showing signs of breastfeeding, then you are ready to have a suitor. So growing up, all I knew or all I wanted is to become a mother and to become a wife. But that changed when I went to the high school. My head teacher, my head mistress, Sister Frances Cassidy, saw the potential in me. And she kept encouraging me. She kept nurturing me. And she even took me through course options. And at the end of it, we settled on nursing. So Sister Frances Cassidy paid my school fees. She bought for me uniforms. She ensured that I had all the necessities that could see me during the nursing school. And so I'm so grateful to Sister Cassidy. And even when I gave birth back months later, years later, I named my daughter Cassidy after Sister Frances. Now this evening, I'm so delighted to share my stories. I'm so excited for this forum. I've been looking forward to it. As a young nurse, it was not easy to rise from one level of leadership to the other. I started by graduating as a nursing in diploma, and again I rose to nursing. It was not easy. The challenges were so many. You are a young adult, you are a young nurse, and you want to come with various innovations that you want to implement. But along the way, I identified role models. And one of my role models was Madam Monica Obutu. Monica Obutu works for Kenyan Medical Education and Trust, Keynote. Monica told me, and I still remember what she told me when we first met, that Naila, problems will always be there. Problems will always be there, and all problems have solutions. Every problem that you counter, Naila, you should see it as a project. I give my shout out to Monica because were it not for her words, probably I would not have put any effort to ensure that I excel in nursing. Now, when COVID-19 came, World Health Organization had declared that 2020 is going to be the year of the nurse. Nobody had prepared us on what was awaiting us. It was a year that we had to be the front line as soldiers, and we didn't have options. We had a lot of fear, we had uncertainty, we lacked proper PPEs, but we still had to soldier on because the trophy or the impact that we create in the human fraternity is so huge than ourselves. It was so painful when you go home and you don't know whether to hug your children, or you didn't have, you are not sure on what to do, but we came out strongly. Now, as the reproductive health coordinator in Kisumu is, my main challenges was the antenatal mothers, pregnant women, the women of reproductive age who needed family planning, and also the cases of sexual gender-based violence. I had to figure out together with the rest of the team, how are we going to approach this pandemic? How are we going to ensure that these women have access to care, which is a fundamental human right? And so I was able to coordinate and ensure that as stakeholders, that is from the police enforcement, because we had curfew and most of the time we know that labor comes at night. So we had to contact the police enforcement, bring other stakeholders in the picture, so that we see how are we going to ensure smooth access for women from their households to the hospitals. And so when we sat down, we identified various strategies that worked for us, and they're still working for us up to date. We identified transport team that could be able to pick women from their household up to the next level of care. Initially, when the pandemic started, we had maternal deaths and child perinatal deaths that were occurring at least every month. We could not get less than 10. But as we see currently, the initiative has worked and is still working, and we believe that we are going to have few women who are dying out of preventable maternal deaths. We also ensured that we carried a lot of health education so that women can be able to access family planning, even at the household level. And those who are not able to access family planning, we ensure that we give them adequate supply so that they will not miss out because of the curfew and because of the pandemic.
Yeah, and Neela, you have done so much amazing work with your colleagues, and as you're talking about family planning, access to sexually reproductive health and services, they're often the most challenged in health emergencies, and especially in this pandemic, we have heard of how many places these services were the first to cut. So, want to truly applaud your commitment and how you brought stakeholders together. So, as we come nearly to a close, what would be your one advice to all of to everyone that's tuning in today, especially on leadership?
I would encourage everyone to have a role model. Have somebody who can mentor you, because you cannot do it alone. You need somebody who you can look upon to. Let us mentor young people so that as we exit, there is somebody who will also take over from us.
Thank you, Neela. And, we want to stay in touch with you as well as all of our midwives and nurses that have joined in today, and just such remarkable work you're doing. Know that we are here cheering you on, supporting you, but also calling for the change so that there are more enabling environments for all of you to do the important work, and for us collectively to create stronger, resilient health systems with a new social contract. So as we're nearing to the end of the session, the challenge is on for our two last speakers to share reflections from all the stories that they've heard, all the fantastic interventions from our partners. I'd like to invite Jim Campbell, who is the director of the World Health Organization's Director of Health Workforce. He oversees the development and implementation of global public goods, evidence, and tools to generate investments in education, employment, and retention of the health and care workforce in pursuit of global health security, universal health coverage, and the SDG goals. So quite a comprehensive portfolio there. And in the context of the pandemic, his present portfolio includes the short and long-term impact of COVID-19 on the health and care workforce, and the oversight of the 2021 year of WHO's International Year of the Health and Care Workers. So Jim, the floor is yours, and the challenge to share some reflection from today's session and steps moving forward.
Dr. Rupa Dutt, colleagues, and all awardees representing the 100 list. Thank you very much. What a wonderful panel this has been. Annette is with us and Rupa is with us. I recall a memory where we had a storytelling of women in global health in Ireland, in Dublin, in 2017. And this is the land of James Joyce. This is the land of the Irish poets. And we had women representing their journeys and everything. So I think the power of storytelling is really critical to this. Obviously, it's got roots in many different cultures. But if we stay with that Irish connection, the work of James Joyce was dissected and by a man named Joseph Campbell, another man of the Irish island, and looked at it and actually went through the journey and the different challenges and the ordeals that we see in all stories. And each of the speakers today has really accentuated that, their departure and why that departure from to go into nursing, what was the motivation, what was the reason for that? Whether that was the Red Cross volunteers, whether that was the sister, the Catholic sister, to try and promote that ideal. Then the ordeals that we have heard, the challenges that are being put in that journey along the way, and how people are overcoming that. That fear, that anxiety, the rejection, the invisibility, the indifference, the battlefield, the tsunami of COVID cases that we're hearing, the cultural gender norms that are really challenging our nurse and midwifery leaders on a day-to-day basis. And yet, we hear in their own words these really positive stories of how they've overcome those challenges, how solidarity, how the voice of a colleague, the voice of a student, the voice of a patient inspires action. We heard the suggestion that it gives that ferocity to overcome this challenge that are in people's way. And each of those journeys is coming forward. And I think it's just an inspiration to hear from around the world some very similar stories coming through on that. How do we learn from the year of the nurse midwife? How do we do what Barbara says? It's not the end, it's the beginning. How do we make sure that the data, the evidence that Elizabeth and Annette are talking about, that Frank is talking about, how do we make sure this evidence is driven into action? How do we make sure applause becomes action? How do we have this social contract, this care compact? And that is what we're hoping to do with the Year of Health and Care Workers. The themes are to protect and invest together. We've heard of the challenge of the infections and the deaths. We need to recognize and commemorate. We need to measure every single health and care worker, male, female, young and old, need to be acknowledged, counted, and recognized for their efforts. We need to carry forward into the political governance cycles. We need to get the investment coming forward. WHO as a partner in the Year of the Nurse Midwife, and a partner in the Nursing Now, a partner in the 100 nurse midwife leaders, is here in solidarity, in support. You represent a substantive majority of the health professions around the world. You represent the agency of women. You represent the agency of change, and we stand with you, ready to work with you. And I congratulate you all. Thank you very much.
Thank you, Jim. And, a lot of work that needs to be done this year. And we, again, acknowledge the critical leadership that the World Health Organization, you and the team have provided and are providing. And we look forward to channeling the energy from this list and this recognition into action. Again, once again, thank you. I'd like to ask our closing keynote, invite her to the floor. Gita Lal is joining us from UNFPA. She is a senior technical advisor and global midwifery program coordinator in sexual and reproductive health branch of the United Nations Population Fund, UNFPA. Since the launch of UNFPA's midwifery program in 2008, Gita has been strategically driving the global scale up and institutionalization of midwifery across 140 countries. And turning it to you, Gita, to close this event for nurses and midwives around the world. The floor is yours.
Thank you so much, Rupa. Good morning, good afternoon to all of you. What a morning this has been. I'm so totally overwhelmed, actually rendered speechless and humbled hearing the heartwarming stories from some of our outstanding heroes providing frontline healthcare and are committed global leaders in nursing and midwifery. Thank you so much to all of you for your wonderful testimonies. As Barbara mentioned, Barbara Stillwell said early on in the morning, nurses and midwives are mission critical. Bravo. Thanks to Women in Global Health for this outstanding initiative. We truly appreciate partnering on this and for highlighting these wonderful stories. The stories we heard today reflect that nurses and midwives from across the world are driving and challenges. But apart from the leaders and those documented on the new website, there are millions of nurses and midwives out there who are our daily unsung heroes, to whom we owe our gratitude. We salute each one of you and look forward to hearing your stories as well in coming years. We will not stay with just a single story, as Elizabeth said earlier on. When WHO designated 2020 as the International Year of the Nurse and the Midwife, it was to have been the first global recognition of its kind, something that was really long overdue. 2020 was to have been a year where one would celebrate, recognize, pay tribute to the hard work of all the nurses and midwives and the years of selfless service, despite very difficult working conditions at times. Millions in developing countries still lack access to high quality education, training, regular pay, supportive and safe environment, and opportunities for career advancement. Franca mentioned a gender pay gap of 20%, and this is not to mention the unpaid work. And who could have thought that 2020 would also turn out to be a monster where the world would face the horrific COVID-19 pandemic? The fear, the stigma, the economic collapse with entire health systems, even of the most developed nations in the world, including where I'm sitting right now, continue to give birth. During the time of the pandemic that is still ongoing, unfortunately, the bravery, the resilience, the fortitude, compassion has been truly inspiring. They have not only tried to ensure survival of the weak and the sick in a highly challenged and compromised healthcare environment, but at the same time, nurses and midwives have had to face their own fears of getting infected or even dying. They faced acute post-traumatic stress and were discriminated against when it came to personal protective equipment, for instance. Many fell victims to gender-based violence, and thousands, very sadly, have lost their lives. New website being launched today in honor of the Year of the Nurse and the Midwife lists 100+ stories, amazing stories. But we need, as I said, we need many, many more stories. And we hope that we will continue to document these. Today, there is ample evidence that midwives and nurses transform healthcare, and they have the potential to save millions of lives. Tons of studies have been published. The question here remains, if it is really so obvious, then why are we not adequately investing in our nursing and midwifery workforce? So I'm going to close with 3 messages. You know, the 3 key issues as I see it is, number 1, there is a need for clear forward-looking health workforce policies that foster and promote the nursing and midwifery workforce. Their proper regulation, they should be allowed to practice to their full scope, and their adequate distribution distribution, and retention. The UNFPA therefore calls on all partners and governments to introduce positions of chief nursing and midwifery officers when none exist, because only then can we have a functional healthcare system and provide an overall enabling environment. The second key issue is the quality of service delivery. Unless we address quality, the respectful maternity care, we cannot save lives. Therefore, we need higher levels of investment going into pre-service education, into continuous professional development, competence, leadership, partnerships, and also innovative approaches. So we all need to come together to promote all of this. Thirdly, and lastly, we need leadership within the nursing and midwifery professions. So we have so many of you out here, but we need thousands more, and also interprofessional. Only when we address the above can we achieve the Survive, Thrive, and Transform agenda of the UNSG's global strategy on women's and children's health. Following the State of the World's Nursing Report in 2020, this year, as you know, as many have mentioned, the State of the World's Midwifery Report will be coming out. And as Jim mentioned in his last comments, we urge you all to use this data for policy advocacy in your respective countries to create an enabling environment for the health workforce. And finally, in closing, I first extend a heartfelt, huge thank you to you, Rupa, and Women in Global Health for this wonderful, wonderful initiative. I warmly thank all the panelists for sharing your personal stories. I thank the moderator for professionally managing the whole show, and thank all our valued partners, Women in Global Health, WHO, ICM, ICN Nursing Now, for documenting these inspirational 100+ stories, and for launching this website and the call to action. Finally, and most importantly, heartfelt thanks to hundreds of colleagues joining in from all around the world and listening in. Congratulations to all. As Deborah said, dream big, remain open, and opportunities, and dance through your journey. I thank you.
Thank you, Gita. And on that note, I would like to formally close this program and acknowledge all of the amazing 100+ women nurse and midwife leaders. We know they represent millions and millions, and we must continue to multiply. And really a special thanks to all the partners for coming together to put this collaboration, and especially the countless hours and dedication from the steering committee to making sure that we were able to get to where we are today. So on that note, let's continue to turn this recognition into action in the year 2021. Please, everyone, take care and stay in touch. Bye-bye.